This is Dr. James DeLapp with the University of Colorado School of Dental Medicine with a video snippet on operative competency grading. This grading will consist of two components. The first, a routine daily grade, and number two, the competency grade. First, take care of the daily grade so you can dismiss the patient. Go to the Treatment History tab and click. Find the procedure code, the non-X code, and double-click on this. This brings up the Edit Plan Treatment form. Notice in the Code section it lists the procedure as 2392. Click on the radio icon button for completed treatment. Hit OK. Next, click on the Aqua box at the bottom of the screen. This brings up the Patient Approval dialog box. Find the non-X code procedure and click Approve. Your instructor swipes a User Authentication dialog box. The routine grading form appears for the non-X code procedure. Have your instructor grade as usual. The instructor swipes their card and you can dismiss your patient. Next, have the competency graded. Click on the Treatment History tab. Scroll down and find the X code. Double-click. This brings up the Edit Plan Treatment box. Notice the code now is X2005. On the same form, click the radio icon button Completed and click OK. Click on the Aqua box at the bottom of the screen. This brings up the Patient Approval box. Select the X code and click Approve. Have the instructor swipe their card. This brings up the most critical element, the Add Edit Evaluation form. Under Discipline, fill in Comp Care. Under Form, select the 8th selection, Operative Dentistry Comprehensive Exam. Next, hit OK. This brings up the blue Student Self-Evaluation form, which the student fills out and hits OK. No instructor swipe is needed. This next section is critical. Notice the User Authentication box now has three choices: OK, Instructor, and Held For. The simplest way to select an instructor is for instructor number 1 to swipe their card. The second method is to click on the Instructor tab, which opens a list of instructors to choose from. The choice may be the Held For tab. This is clicked on when an instructor is not available at the end of the procedure and needs to be graded at a later date. When this is clicked on, a list of instructors can be viewed and selected from. Let's go back to the easiest method, the instructor card swipe. Have instructor number 1 swipe their card. The form that appears now has changed from blue to white. The instructor fills out the evaluation and hits OK. Notice a User Authentication box appears with only two choices: OK and Cancel. The instructor swipes their card to approve the evaluation. A second User Authentication box appears with three choices previously described. The simplest method is for instructor number 2 to swipe their card, but other methods are available. Instructor number 2 completes their evaluation and hits OK. The final User Authentication box appears, and instructor number 2 swipes their card to complete the evaluation process. This has been Dr. James DeLapp with a video snippet on operative competency grading.